When people hear about the keto diet, their first thought is, eating all this meat and fat must be bad for your health. And unfortunately, even many doctors still promote this outdated thinking. But in recent months, both the American Heart Association and the American Diabetes Association have finally published statements and articles declaring that keto and low-carb diets are not only safe, they are effective at improving diabetes, improving heart health, and reducing weight. In January of this year, the American Heart Association's Executive Committee and Science Advisory and Coordinating Committee published a joint scientific statement on cardiovascular health for adults with type 2 diabetes. It talks about how more than 34 million Americans now have diabetes, and cardiovascular disease is now the #1 cause of death for adults with diabetes. Page 8 of the report discusses how Mediterranean, paleo, low-carb, high-protein, vegetarian, and diets high in nuts improve glycemic control and weight loss. Now, by itself, that's not necessarily news, but it goes on to specifically talk about very low carbohydrate diets. It doesn't define it, but it's clearly discussing keto, while at the same time trying to avoid using the K word. But it states, very low carbohydrate versus moderate carbohydrate diets yield a greater decrease in A1C, more weight loss, and use of fewer diabetes medications. And it says, for those unable to adhere to a calorie-restricted diet, a low-carbohydrate diet reduces A1C and triglycerides. It's almost easy to miss, but for the first time, the American Heart Association is on record stating that low-carbohydrate diets improve triglyceride levels, and that very low-carbohydrate diets, meaning keto, reduce A1C and levels of diabetes medications. Thus, the American Diabetes Association recommends an individualized nutrition plan focusing on total calorie and metabolic goals. I think one can safely read between the lines that the American Heart Association is very quietly implying we also recommend all the above strategies: paleo, Mediterranean diet, low carb, and very low carb, meaning keto. Now, what's also important is what it doesn't say. The statement doesn't try to repeat the old outdated, unsubstantiated claims that keto or low carb has any negative effects on cardiovascular health. In fact, most studies now show keto and low carb are likely to improve cardiovascular health as it improves overall metabolic health. And the American Heart Association isn't the only major medical association that's starting to rethink keto. A few months earlier, the American Diabetes Association published its May 2020 issue of Spectrum magazine with updates on nutrition guidelines. Now, if you scroll to the very bottom, the very last item is an article on low-carb and very low-carb diets for patients with diabetes, but we'll get back to that in a second. If you scroll back up to the top, the issue was about updates to the American Diabetes Association nutrition guidelines, and in a guest editorial, a member of the ADA's National Scientific Review Committee states, there is no one best eating pattern for diabetes. It's clearly signaling the ADA is encouraging people to find the diet that works best for each individual. So the issue goes on to talk about the Mediterranean diet, the DASH diet, vegetarian, and even intermittent fasting. But let's get back to that last article on low carb. It says low carb and very low carb ketogenic diets can not only be attractive options for treating patients with diabetes and obesity, but have the added benefit of significant reductions in the need for insulin and other diabetes medications. The article goes on to back up its claims with scientific data, including 8 studies of keto, 3 of which showed significant improvement in A1C levels, while the other 5 showed stable blood glucose levels. It cites 4 studies where up to half the patients on keto achieved sometimes complete remission of their type 2 diabetes within 2 years. The article goes on to discuss improvement in cholesterol markers and reduced risk of cardiovascular disease and significant improvements in weight. The article concludes, this dietary strategy appears to be safe and effective in most patients. Let me say that again. Safe and effective in most patients. Now, of course, it cautions talk to your doctor and follow proper medication regimens, but it is a significant change for the American Diabetes Association, which previously had said very low-carb diets were not recommended. And unlike the American Heart Association's scientific statement, the new American Diabetes Association article isn't afraid to use the word keto, and in fact mentions keto, ketones, or ketosis 75 times. For the scientists, physicians, and healthcare practitioners who have been fighting the lonely battle to combat misconceptions that keto doesn't work or is somehow unhealthy, this was vindication.
The very next time you see a cardiologist, a cardiothoracic surgeon, an electrophysiologist, or a mid-level provider that works for one of these guys, and they say, oh no, don't do keto, it'll kill you. Don't do low carb, it's bad for you. You can say, hey, dummy, the American Heart Association in their latest scientific statement said that that is a viable alternative. I actually took the liberty of printing out this scientific statement for you and bringing it to this office visit today because obviously you have not read it. So all you cardiologists out there, get ready for the low-carb ketogenic wave, because if you say keto will kill you or low-carb is dangerous, they're going to wave this scientific statement in your face and say, do you not keep up with your reading, doctor?
So if your doctor or dietitian is opposed to trying keto and says it's unhealthy, it's too much fat, it's going to give you heart disease, as Dr. Berry suggests, print out these reports, highlight those sections, and show it to them. The links are in the show notes, or reach out to me for more information. This is the very latest research on keto, diabetes, and heart disease. It goes against what some doctors and scientists have been saying for decades, because now we finally have the scientific evidence to support that not only is keto healthy, but done properly, it can help improve diabetes, heart disease, weight management, and overall metabolic health. If the video was helpful, please hit the like button and leave a comment or question. It really helps me to reach more people and produce more videos. And don't forget to hit the subscribe button and the little bell to be notified about more videos. Thanks for watching, and we'll see you next time.